which of the following conditions is most likely responsible for this patient's clinical presentation? 45-year-old woman presents with flaccid blisters on her skin, which easily rupture with slight pressure. The blisters are filled with clear fluid and surrounding skin is erythematous. Skin biopsies performed, and histological examination reveals separation of keratinocytes in the epidermis. All right. Which of the following conditions is most likely responsible? She has these blisters. Key thing here is separation of keratinocytes within the epidermis, so it's not like the hemidesmosomes or desmosomes. Not psoriasis. It stays in the epidermis. I'm going to get rid of pemphigus vulgaris and bullous pemphigoid. Flaccid blisters on her skin. Clear fluid. I mean, dermatitis herpetiformis makes sense because they're herpes-like. I'm trying to think of what disease that goes with. Dermatitis herpetiformis. I can't think of it. But yeah, I think I would go with that. I mean, they're not. Are they bullous? Yeah, I mean, if it's just those keratinocytes in the epidermis. They're like C or E here. But I don't know what that is. I don't know what epidermi
Okay, so what do you want to
lysis.
go with?
So I'd go with dermatitis herpetiformis.
Okay, so let's talk about this. This is a very key portion that I want to talk to you about. Okay, they
Okay.
ask this a lot. Okay, so you got to know what separation of what layers causes what disease.
Yeah, that's.
So
I thought it was like desmosomes or hemidesmosomes with pemphigus
so
vulgaris and stuff.
those are the connections.
Okay.
The desmosomes are kind of the connections between kind of the um, keratinocytes versus the epidermis, right? And so it
Okay.
kind of separates. And also on top of that, right, the flaccidness of it, right, is going to be pemphigus vulgaris. Bullous pemphigoid doesn't have flaccid, and these are the hemidesmosomes, which connects that epidermis to the basal layer of the epidermis, right?
Hmm.
The basement membrane, right? So that disconnection is going to be the hemidesmosomes, right? Dermatitis hermetiformis, they do look like herpes-like lesions, but it's usually on the skin, and
Hmm.
they call them as vesicular, right? And this happens with celiacs, okay?
That's what it is. Okay.
Celiac disease, psoriasis, right? Scaly skins on extensors, right? So not that. Epidermolysis bulli, inherited disorder characterized by skin fragility, blister formation, often a response to minor trauma, but it's usually structural proteins such as keratin, lamin, or collagen. So not that. But yeah, so here kind of right. Separation of keratinocytes in the epidermis are consistent of pemphigus vulgaris, autoimmune disorder, auto antibodies against desmogliin, which is a component of desmosomes, which is what you kind of remember. But just kind of remember it's that loss of cell adhesion in the epidermis, or aka like
Okay.
part of the keratinocytes in the epidermis. So they like asking this multiple different ways. So you got to remember everything associated with it, right?
Okay.
Because most people remember the desmosomes, but they don't remember like what do the desmosomes attach to each other,
Okay.
right? And same with bullous pemphigoid, right, which is kind of the hemidesmosomes, which connect the epidermis to the dermis, or aka like the basement layer, right? So it's
Yeah.
good to know all that because they can ask it each way, any which way. So
Okay. Yeah, they asked this a lot. They asked those two a lot. And I just didn't think it was that because they didn't mention um, desmosomes or hemidesmosomes, but that's not really the point. Okay.
gotcha.